And one. Hi, you must be Megan.
Yep, that's me.
Okay, so I'm your counselor, Viviana. So this is your first session with me. So to kind of start things off, we're going to discuss your professional disclosure statement that you signed and sent back to me, along with, one or two things I noticed on your intake form. Just to kind of get us started for our counseling journey. Are you ready to start?
Yes.
Okay, so we're gonna start off with your professional disclosure statement. I am a graduate student working toward my master's degree in professional counseling. I am currently practicing counseling techniques and therefore we're recording our session. Only my professor and classmates will see the tape, and the recording will be destroyed at the end of the semester. Likewise, you should know there's some limitations to my counseling, so please note that it is not possible to guarantee any specific results regarding your counseling goals. However, together we will work together to best achieve the best possible results for you. Any questions about that?
Nope.
Okay, we're going to discuss your client rights. So it is your right anytime to inquire about the processes and procedures being used during our counseling relationship. You also have the right to refuse or, request changes to any of my suggestions that are made. And if at any time you are not satisfied with my services for any reason, you can inform me or my supervisor, Dr. Frederick, which I will be providing her with your information with her information along with any other things that might be brought up or any paperwork we might have along with the rest of this session. Once you begin counseling with me, you're not obligated to continue counseling with me. I do ask that you attend a termination session, which is just a little session where you come in and we discuss some things that you like, that you didn't like, why you might be ending services with me, and just like any other feedback that you might have for me. um, so along with that, should you desire a referral to another therapist, I will provide you with one. And my services are rendered in a professional manner with, with ethical standards that are consistent with the American Counseling Association. If you have a complaint concerning malpractice, this can be reported to my supervisor, Dr. Frederick. Do you have any questions or concerns when it comes to your client rights?
No.
Okay. So moving on to confidentiality, everything we discuss will remain confidential in this session unless I determine you an imminent danger to yourself or to others. If you report child and elder abuse or neglect, if your records are subpoenaed by a court of law, if you disclose sexual contact with a mental provider with whom you've had a professional relationship with, if information is requested by your contract provider, so this would be, like HMO, insurance company, etc. If I am directed by you in writing to disclose information to someone of your choosing, which of course you don't have to do that. This can just stay between me and you. There's no pressure there. And if you bring a malpractice suit against me. Any questions or concerns with your confidentiality? Okay. You are also aware that this session may be recorded, and this recording is for the benefit of my evaluation, and if recorded, will only be viewed by my professors and classmates, and this recording will be destroyed upon completion of this course. And of course, you signed saying that you have read, understand, and agree to this agreement. Okay. So one thing I noticed on your intake form was anxiety. Do you kind of want to tell me, you know, if it's just one thing or if it's multiple things, that might be causing you anxiety?
Um, I think there's multiple things. I think it's almost like in every aspect of my life.
So so we said it's almost like every aspect. So let's start with the number one thing. What is the biggest aspect right now that's causing you any anxiety?
Um, you know, um, the biggest,
Or one that you feel comfortable talking with. There's no pressure.
um, I guess the biggest is just um doing things like out of the ordinary,
So
I would say.
breaking that routine that you have. So do you have an example of a situation that might have happened recently that caused you a lot of anxiety that would kind of like fall into this category?
Um, yeah. I have. Recently I started a new job and my anxiety so far has just been through the roof. Just like since I started this job, like my anxiety has been
Do
higher
you
than normal.
do you mind repeating that real quick? Sorry, you kind of buffered out for a second.
So I recently started a job and um with starting this new job, it's like new. So my anxiety has been like really high, and so it's been higher than usual with all this news.
Okay, so when it comes to the anxiety, that's like, do you think it's just the start of a new job that kind of like just came in on your routine, or do you just think it's the job in general?
I think it might be the job in general because I'm like doing things I don't normally do like in the job. So I'm like talking to people, newer people, and of course like the anxiety about not messing up at the job because it's like very like crucial to have like the right information um with completing everything.
Okay, so we talked about that, and I know there's some other aspects going on as well. So it seems, just like anxiety is something that it seems like you've dealt with for a while. I noticed too on your intake form you are in college, so um I guess one thing I want to ask because college, you an adult, you're studying a new chapter and it can cause a lot of anxiety and stress and worry. So I guess just one thing is, like what kind of goals do you have when it comes to, counseling? What do you hope like your goal is when it comes to attending counseling?
I would say my goal is to hopefully like get better where it doesn't like try to control my life, where I don't where I just stay in my natural little bubble, you would say. Um yeah, so I'm hoping, I mean that's like my main goal.
Okay. So that is a really big goal and it's an awesome goal. So I hope we can get you there. So of course, with all things, we have our big goal. In order to achieve this big goal, we need to start off with a smaller goal. So we know that work's causing you a lot of anxiety and stuff like that. What other aspects do you think affect your anxiety as well?
I would say like not knowing the future. So like you said, like I'm a college student, so knowing like that next step. Because I mean, with people around you, they're expected to know like what your next step is. And so when you don't know, it like puts a lot of anxiety about like what's happening or what's going to happen.
Okay. So we're talking about school. So do you think school's kind of on the smaller, like one of the smaller things that are causing you anxiety, or do you think there's something smaller than that that might cause you anxiety?
I think right now that's the smallest of it.
Okay. So, like I said, in order to reach that big goal of like having like anxiety not control our lives, we gotta start off with some smaller goals. So, I guess our smaller goal we can start off with is school. What is one thing in school right now that's causing you anxiety or, any type of things like studying, tests, anything like that?
It would definitely be my exams. I have a lot of classes that are like really test heavy, and I'm not exactly. I have a hard time taking exams because I get nervous taking them. So I would guess that would be the smallest in school.
Okay. So, we're gonna start our goal setting. So, to try to overcome this, it's going to be one step at a time. How about, we try to set a goal. What kind of goal would you like to set for school and anxiety? It can be over anything. You talked about tests, but there's like another aspect that maybe you think we can try to, overcome that anxiety. That's totally fine. Um, we're just going to try to keep you comfortable and, everything's at your pace. This is, your goal. So,
Um, I'm not sure to be honest.
okay. So, what year in college are you?
I'm a senior. I'm supposed to be graduating soon.
Awesome. So, do you think graduation might be causing some anxiety as well?
Yes.
Okay. So we're gonna try to tackle this and just let me know if you want to, like I said, you have the right to, change anything any of my suggestions. So when it comes to your anxiety, let's try to use anxiety coping skills before we go in for a big test. How does that sound? You think that sounds reasonable? Like at least one anxiety coping skill.
Yeah, that sounds reasonable.
Okay, so I have a paper here. I'm also going to be sending this to you. We're just going to kind of discuss some of the things that are on there. And if you think there's anything on there that might appeal to you, just let me know. We're going to go over four of them. Um, just going to kind of go through them. And if you think there's anything that appeals to you, we can kind of go into, a deeper explanation of it because there are some on there. You can read them or I can just talk to you about it. So the first coping skill is deep breathing, which, something that can be used, right outside the testing room or in the testing room itself. Um, we have progressive muscle relaxation, which, could be used in the testing room, maybe if you get there ahead of time or, before you leave, your home and go to school in the vehicle before you walk to before you walk to class. Then we have challenging irrational thoughts, which, could also happen, just like deep breathing in a testing room, outside the testing room, anywhere you feel like, you might get that anxiety about this test or, even, trying to feel something out for graduation. And then we have imagery, which we can go into more detail about that. So when it comes to those four, which ones do you think it can just be one or, two of them? Which ones do you think would be good for this goal of, trying to use some coping skills before, a test or something?
Could you repeat the first one, please?
Deep breathing. Do you want me to kind of go into some detail about it real quick?
Yeah, I think, well, I mean, I thought it was the first one, but yeah.
So deep breathing is a simple technique, like I said. It's discreet, you can use it easy anytime or place, kind of like how we discussed, again, like, in the testing room, stuff like that. So kind of what you want to do is just sit comfortably. You want to place one hand on your like abdomen, on your stomach, breathe in through your nose, and you want to feel your abdomen kind of rise up with that. And you're gonna hold in the air, and then you're just gonna go just kind of slowly. I'm pretty, this is something a lot of people do, but it's so effective. Um, so the secret is to go slow. So you want to time in 1, 2, 3, 4, pause, 1, 2, 3, 4, and then exhale. So in 6 seconds. So and it says 3 to 5 minutes, but if you calm down or your anxiety kind of goes down sooner, that's totally fine. Like I said, I'm going to be sending this to you as well. So if there's anything else on there you want to try, that's fine. Um, Kind of keep going with this goal setting. What kind of situation do you think you could see yourself using this in, within the next week before our next session?
Um, Situation I could see myself using it in. Um, I have this presentation coming up, so and I get nervous about presentations, so I think the deep breaths would work for it. I can use it before we meet next.
That's awesome. So there goes our little goal for next session. And if there's any other situations that come up as well, just you can always just keep that in mind. Um, so we're gonna go ahead and move on with some, homework that I'm gonna go ahead and send you some papers over. And then we'll kind of just, sum up what we talked about and, we'll end there. So the first one I'm going to send you is called Countering Anxiety. You'll see it better. I hope you can see a little bit, but you have the squares where the anxiety producing thought and then your rational like counter statement to that. So like for example, on here it's like I can't go to the mall with my hair like this, everyone will notice me. But then that rational counter statement is my hair looks a little messy, but everyone will be too occupied with other things to notice. And if they do notice, I doubt they would care. So one thing I want to do is there's two more example ones, and you would fill out the, your own like rational counter statements you would have. Underneath that, it doesn't all have to be done in one day. It can be done throughout the week until I see you next time. You're going to want to write maybe one anxiety producing thought you had that day, or you're having in that moment if you're at home working on some homework, and write that rational counter statement out. So, how does that sound? That sound okay?
That sounds good.
Okay. One more worksheet. I don't want to try to overwhelm you, but um, I just want to also make sure that we're, trying to, get to those goals and stuff. And I think that, these thoughts is like the first kind of step that we might want to take along with those coping skills. So then the next one is called challenging anxious thoughts. There's going to be different boxes. So the first box is you're going to describe a common situation that triggers your anxiety. So for example, we talked about, test taking, that presentation you have. So we could kind of put that in there. And then after that, we're gonna put, imagine you're faced with, the situation, so the test or the presentation. Um, and so in the box you have 3 lines, and it's, just describe what's the worst outcome that could happen in that situation. Then describe what the best outcome is for that situation. And then write the likely outcome. So what you realistically see happening. Um, So under that box, we're going to imagine the worst outcome comes true. So the worst outcome of, taking that test or that presentation. And you're going to put, would it still matter 1 week from then, 1 week from that test? Would it still matter 1 month from the test? Would it matter 1 year from the test? Um, so usually anxious thoughts focus on the worst possible outcome that we have, which, as a student, I can see because, the grades are important, getting through all that's very important, even when they aren't likely. So it's that's why we're kind of writing that down because we just want to see, will it still matter? So, and then after that, using your own worst outcome and likely outcome from above, you're going to describe your irrational thought. So, what was that irrational thought? Thinking about that worst outcome. And then your rational thought, which is like, okay, I'm thinking through it. This is likely what's going to happen. So, that's also another worksheet. Like I said, it doesn't have to be done on a particular day. It can be done, on another day. Maybe it doesn't happen with the presentation, maybe something from work happened. But like, our goal is trying to focus on school first. We're going to tackle school first. So any questions or concerns with that paper? Anything like that? Okay. So real quick, I have a mindfulness exercise for you because, once we clear our mind and everything, we can kind of just clear that anxiety. Our body just relaxes. Um, and of course, as a student about to graduate, it's best we kind of learn this kind of stuff because there's so many stresses that can cause this anxiety and just trigger that anxiety. So I'm going to walk you through this. So are you sitting in a pretty comfortable position, you'd say?
Yeah.
Okay. So what we're gonna happen is close your eyes or just soften your gaze. Take 3 slow deep breaths. So inhale, exhale through the mouth. 2 more. Breathe in, exhale. And the last one, breathe in and exhale. So let yourself feel at ease in this moment. Slowly just kind of take in your surroundings. You want to keep your eyes closed. Um, recognize your thoughts, feelings, any physical sensations, and you can go ahead and name those out loud, or you can just, silently to yourself, just kind of, recognize those thoughts and stuff. Just let me know when you're ready to move on.
Sorry.
You're okay.
I'm
Okay.
ready.
Okay. Sorry, I just saw we have the Zoom stuff. Anyway, so you want to close those eyes again. So you want to observe your experience in this moment right now, as if you're watching a movie. So let your thoughts, your feelings, sensations come and go as they are. You want to let go of any judgment. It is okay to feel however you are feeling. So you may tell yourself, this is how it is right now. This is the situation right now. Don't just let go of any judgment you have towards yourself in this situation. So, what words are going through your mind? What emotions are you feeling, and where are they coming from? How are these feelings experienced in your body? Sense the most vulnerable part of yourself and reflect on what it needs at that time, such as acceptance. You need acceptance, forgiveness, love, or belonging. And then the last step of that is be kind toward your experience that you're having. So give yourself a comforting message that's, I love you, you are okay, or anything else that you need. And then think of a friend, family member, pet, or a spiritual figure, and imagine their love just flowing to you. Just just have the eyes closed. Imagine that person and just imagine just all this love. It can be a color, it can be, you know, leaves or whatever, and whatever imagery you have of that love just flowing to you. And you just want to let in the healing and compassion until you feel calm and centered. And then before you open your eyes again, we're going to take 3 slow, deep breaths again. Inhale, exhale. 2 more. Okay. And when you're ready, you can open your eyes. Sorry. Okay. So that's called the rain technique. I am going to send that to you as well. So just kind of to sum up anything, to sum up the session, we discussed your anxiety. We discussed our big goal of not letting anxiety control our life. We made that big goal and set our little goal of, just trying to manage that in our school setting right now. I will be sending you these sheets. They are homework, so we just want to try to finish them within next week. And other than that, that is the end of your first session. Any questions or concerns?
No,
Thank you.
thank you.